Greetings, my friends. Welcome to my show. This is Dr. Jaime Daniel, and today I want to share with you an overview of Osteogenesis Imperfecta. It is a genetic or heritable disease in which bones fracture easily, often with no obvious cause or injury. Osteogenesis imperfecta is also known as a brittle bone disease, and the symptoms can range from mild with only a few fractures to severe with many medical complications. For most people, a change or defect in the genes that carry instructions for making type 1 collagen causes osteogenesis imperfecta. Type 1 collagen is a material in bones that helps make them strong. The defect in the genes causes the body to make collagen incorrectly or not make enough, leading to weak bones that break more easily. There is no way to prevent the disease. Though anyone can be born with osteogenesis imperfecta, people with a family history of the disease are at greater risk of inheriting the disease through an abnormal gene that is passed on from one or both parents. Genetic counselors can help you better to understand the genetics of osteogenesis imperfecta. There are several types of osteogenesis imperfecta, and different classifications are used based on the severity of the disease or on the nature of the underlying gene defect. Type 1 is the mildest and most common form of osteogenesis imperfecta. Type 2 is the most severe form of osteogenesis imperfecta. Other types of osteogenesis imperfecta have symptoms that fall between type 1 and type 2. In the type 1 of osteogenesis imperfecta, we are going to find some features like bones are likely to break from mild to moderate trauma, with most broken bones occurring before puberty. There are no change or only slight changes to stature with aging, loose joints and muscle weakness. We also find blue, purple or gray tint to sclera. It is the whitest of the eyes. Also, we will find triangular face, a curved spine with potential for compression of the vertebrae with aging, mild or no bone deformity, possible changes to the strength and color of the teeth, possible hearing loss, normal collagen structures but less than the normal amount. Now, if we talk about type 2 of osteogenesis imperfecta, the features are going to be the next ones. Frequently causes death at birth or shortly after because of the inability to breathe. Numerous broken bones that develop before birth while the baby is still in the womb. Severe bone deformities, very small stature, underdeveloped lungs, blue, purple or gray tint to sclera, improperly formed collagen. In type 3 of osteogenesis imperfecta, most severe type among those who survive the neonatal period and usually results in the greatest number of physical disabilities. Easily broken bones with very little trauma over a lifetime. For example, broken bones are often present at birth, and X-rays may reveal healed bone breaks that occurred before birth. Small stature. Blue, purple, or gray tint to sclera. Loose joints. Poor muscle development in arms and legs. Barrel-shaped rib cage. Triangular face. Curved spine and compression or collapse of vertebrae. Possible lung problems that worsen with age, often severe bone deformity. Possible changes to the strength and color of teeth. Possible hearing loss. Also improperly formed collagen. In type 4 of Osteogenesis Imperfecta, bones break easily, sometimes before birth, with most broken bones occurring before puberty. Smaller than average stature, white or blue tint to sclera, mild to moderate bone deformity, vertebra compression or collapse, barrel-shaped rib cage, triangular face. Possible changes to strength and color of teeth. Possible hearing loss. Improperly formed collagen. And in type 5 of Osteogenesis Imperfecta, clinically similar to type 4 in appearance and symptoms. A dense band seen on X-rays by the cartilage growth plate of the long bones. Unusually large callus called hypertrophic calluses at the sites of fractures or surgical procedures. A callus is an area of new bone that is laid down at the fracture site as part of the healing process. Calcification of the membrane between the radius and ulna, which results in restricted arm movement. Possible loose joints, white sclera, no changes to teeth, mesh-like appearance to bone when viewed under the microscope, and changes in the mineral in the bone. In type 6 of Osteogenesis Imperfecta, it also resembles type 4 in appearance and symptoms, but not always diagnosed at birth, and symptoms progress over time. Fish scale appearance to bone when viewed under the microscope. Curved spine. Diagnosed by bone biopsy or genetic studies. Changes in the minerals in the bone. And in type 7, it also resembles type 2 and type 3 of Osteogenesis Imperfecta in appearance and symptoms. We will see also a white sclera, small stature, short humerus, and short femur. Possible smaller head size. Changes in the process of forming collagen. And talking about type 8 of Osteogenesis Imperfecta, it resembles type 2 and type 3 in appearance and symptoms. We will find white sclera, small stature, short humerus, and short femur. possible smaller head size, changes in the process of forming collagen. There are rare types of the disease, and in general there are moderately severe forms. These types are similar to osteogenesis imperfecta type 3 or 4. Some of these rare forms do not affect the structure of collagen but instead affect the function of bone-forming cells. All people with osteogenesis imperfecta have weak, brittle bones. Some people with osteogenesis imperfecta may have only a few broken bones over their lifetime. Others may have hundreds of broken bones in their lifetime, including broken bones that occur before birth. People with osteogenesis imperfecta may have other symptoms, which can range from mild to severe and vary from person to person. These include things like malformed or bowing of long bones, small stature, skin that bruises easily, loose joints, weak muscles, white of the eyes that look blue, purple or gray, a face shaped like a triangle, a rib cage shaped like a barrel, a curved spine, collapse or compression of the vertebrae in the spine, brittle, misshapen or discolored teeth, hearing loss, breathing problems, a deformed hip joint in which the neck of the femur is bent downward, or condition called coxa-vara. The cause of osteogenesis imperfecta is a mutation or a change in a gene that carry information that determines which features are passed to you from your parents. We have 2 copies of most of our genes, one from each parent. People with osteogenesis imperfecta have a gene that carries incorrect instructions for making collagen, a substance that makes bones strong. The gene causes the body to not make enough collagen, or the collagen does not work properly. This leads to weak bones that break easily. Most people with osteogenesis imperfecta inherit this gene from one parent. In other forms, the child has to inherit a mutation in a gene from both parents. Parents do not have to have osteogenesis imperfecta to pass on the gene that causes it. Sometimes, neither parent passes on the gene. Instead, the gene stops working properly on its own before the child is born. Now, talking about dominant osteogenesis imperfecta, this means they inherit one normal copy and one copy of the gene that causes osteogenesis imperfecta. The abnormal copy of the gene is stronger or dominant over the normal copy of the gene. This causes a person to have osteogenesis imperfecta. A person with a dominant mutation has a 50% chance, 1 in 2, of passing on the disorder to each of his or her children. Some children with the dominant form of osteogenesis imperfecta inherit a gene that causes osteogenesis imperfecta from a parent. while others are born with the dominant form of Osteogenesis Imperfecta, even though there is no family history of the disorder and the mutation occurs in their genome for the first time in the family. Some people with Osteogenesis Imperfecta have a recessive form of the disease. People with recessive Osteogenesis Imperfecta have parents who do not have Osteogenesis Imperfecta, but who both have an abnormal gene that causes the disease. When both parents carry the recessive gene for Osteogenesis Imperfecta, there is a 25% chance, 1 out of 4, for pregnancy of having a child with the disease. Unaffected or asymptomatic siblings of a person with recessive Osteogenesis Imperfecta have a 2/3 chance, 2 out of 3, of carrying an abnormal gene that causes Osteogenesis Imperfecta, making them carriers of the disease. If one parent has Osteogenesis Imperfecta because of a recessive mutation, all of their children will carry an abnormal gene that causes Osteogenesis Imperfecta, but will not necessarily have Osteogenesis Imperfecta. There is no cure for Osteogenesis Imperfecta. The goal of treatment, depending on the type of Osteogenesis Imperfecta, is to prevent or control symptoms, increase bone mass and muscle strength, and maximize a person's ability to be independent. Living with Osteogenesis Imperfecta can present some challenges. Certain activities can help people with Osteogenesis Imperfecta to stay healthy and prevent broken bones. For example, follow a nutritious diet, exercise as much as possible. Regular physical activity can help strengthen muscles and bones. Swimming and water therapies are common choices for people with Osteogenesis Imperfecta because exercising in water has little risk for causing broken bones. Talk with your doctor or physical therapist to discuss appropriate and safe exercise. Keep a healthy weight. Being overweight increases the risk for many health problems such as diabetes and heart disease. Extra weight also adds stress to the bones, which is especially unhealthy for people with Osteogenesis Imperfecta. Don't smoke and avoid secondhand smoke because smoking can also weaken bones. Do not drink a lot of alcohol or caffeine because they may weaken your bones. Seek counseling or talk to a healthcare professional if you feel depressed or anxious about Osteogenesis Imperfecta and its symptoms. Well, I hope you enjoyed this episode and we will see you in the next one. Thank you.